here are some suggestions and movements and exercises to possibly work through some sciatic nerve pain. So first off, go ahead and come to a hands and knees position, and you're welcome to have something underneath your knees here if you would like. So you can always have, where'd my blanket go? You can always have something underneath your knees when you move through something like hands and knees, and any of the movement that goes along with that. So from your hands and knees, you set yourself up, wrists under shoulders, knees under hips. And then give a good push with your hands so you have a broadening through your upper back. And now just a little movement here through your cat and cow, and in particular, as opposed to thinking of making that just a big movement up and down with your spine, think of starting the movement from your pelvis. So from here, I'm going to tilt up with my pelvis, sitting bones lift, and then slowly work through the rest of my spine. And then from here, cow pose, I'm going to tilt down with my pelvis, sitting bones down, and then slowly work that through the rest of my spine. So tilt up, move through my spine, tilt down, move through my spine. I'm practicing just simply allowing some fluid motion to begin to happen, starting to free up some movement through your pelvis. We won't do all 10, but think of going through this at least 10 times. But if it makes you feel really good, then maybe go through more. And now I'm setting the tops of my feet down, and I'm taking my knees wide, but you can always take your knees narrow if you would like. And then you're going to settle your hips back towards your heels as far as they can go. You might even add a little bit of sway side to side if you have that freedom in your hips. If you don't, then maybe you stay A, up a little higher, and B, maybe you don't move as much. Maybe it's just a little movement. Okay? And then go ahead and come back to your hands and your knees. And from here, we're going to try to get into a really tight muscle underneath all your glutes called your piriformis. So sway your hips just a little bit off to the right side. And tilt your sitting bones up. Ready to tilt your butt in the air. And then reach your hips diagonally back. So try to move your right hip to the right side and back. Couple big breaths. And then come on back up to center. And you're going to do the same on the other side. Even if you're not experiencing sciatic nerve pain on one side, you still go there to give yourself the information of how each side is doing. So now hips shift over to the left, sitting bones tilt up, and then diagonally you reach your hips back. And even more so, you're trying to move your left sitting bone, that's the part of your pelvis where you sit, right? Out to the left and back. And then all the way back up to center, and you'll do that on each side twice, okay? We're gonna not go through it twice, but you get to do it twice. So if you need to pause the video, go for it. But then move through a cat and cow again a couple of times in between. Good, okay, now come all the way to your sitting bones. And we're going to take a stretch that should stretch down the outside edge of your leg a little bit, okay? So sometimes that's into the hamstrings, sometimes that's into the IT band, sometimes that's into the pocket muscle called your TFL or your tensor fasciae lata, okay? So now, my left leg, my thigh bone gets to stick straight ahead, and then my leg comes out at about a 90-degree angle. And then my right leg, my knee comes out straight ahead to the right side, and my leg again at about a 90-degree angle. So So you get to notice what this is for you. Right here might be a lot of sensation, okay? Press down with your fingertips and lift up higher. And now you're going to turn your torso so that you're facing your front leg, your left leg here. It means that your right hip is going to roll a little bit forward, and that's okay. So now, if it's in your practice to fold a little bit over your leg, then you're welcome to fold. Maybe even walk your way all the way out. You can always have a prop, like a block, underneath your arms here. Or if that's just way too much, stay tall. So one of the ways that you can tell whether it's too much is if your nervous system starts to really tense up, or if you start to round your back. Okay, so you want to stay nice and long through your spine so that your pelvis can tilt, your belly's coming forward. Okay, and then we're going to switch it to the other side. So inhale, rise all the way back up if you're folded. And then you're going to bring your right leg forward, and then both legs forward. And then we'll switch our legs to the other side. So right leg, thigh bone, straight ahead, 90-degree angle with your leg, approximately. Nothing's perfect, right? Left leg, again, straight to the side, 90-degree angle approximately. And then you're turning your torso toward your right leg and lifting up tall. Okay, and then from here, maybe upright is where you stay. Remember, we're going to go from a long spine, and we're going to stay a long spine, so we're hinging from our hips and not rounding our back to fold. So if you have some space in your body to fold, then you might come down toward your forearms. You might come down toward a block or a prop, or you might stay more upright. Anywhere in between, you find what works the best for your body. Okay, so take a big breath. And then we're going to do both of these sides again, or rather you're going to do both of these sides again. Okay, because it's the best way for your brain to realize that you're stretching. Okay, so now you can bring your left leg forward and your right leg forward. And from here, hands to your knees, and start to move through a few rounds of cat and cow. Just letting yourself move through your spine. Good. Inhale, sit tall. And now we're going to make our way onto our bellies. So one of the really helpful things for your sciatic nerve is back extension. Okay? So we're going to come onto your belly. And you can do this standing up to or at a wall. But then you're going to bring your elbows directly underneath your shoulders into a sphinx pose. And if your body is saying, oh, that's too much, then maybe walk your elbows out a little further away from you. Wherever that is for you, you get to take a moment to lock your legs in so that they're hip distance apart, and give a push down with your toes and a push down with your knees. And now you're going to use your breath to help you suck in with your low belly and your low ribs. So take a big exhale and pull them in. And then lift shoulders up and back. Good. Push with your hands and lift your chest. Take a deep breath. And then gently lower all the way back down. Your head can come down to your hands if you want. Bend your knees and windshield wipers. Sway your hips, sway your legs. You might get a big movement all the way up your sides, or it might just be a little bit of movement. And then one more back extension. You can come to that same one with your elbows underneath your shoulders, or if you want to this time, you can take arms back alongside your body so that your thumbs are aimed down. Shoulders will lift up and back. Your head becomes in line with your spine. Push down with your feet, knees, so much that your sitting bones lift up a little bit. And then find that exhale to draw your low belly and low ribs in. Inhale, shoulders up and back. Maybe you lift your legs, hugging them in toward each other. Take a big breath. Then use your hands on the ground to push you all the way back, hips to heels. Take a child's pose, a little counter pose to those spinal extensions. And then push yourself all the way up to your seat, and then down onto sitting bones. And now we're going to come all the way onto our backs. And for this, we're again going to try to get into that little hip flexor that's underneath your glutes that gets super tight and it pushes right against the sciatic nerve, so your piriformis. So feet on the floor, and then you're going to cross left ankle over your right knee. From this place, if it's in your practice to lift your legs up, you're welcome to. If that's not in your practice, then you can keep your foot right on the ground. So now, 2 actions we're going to take. Number 1, whether your foot is lifted or down, you're going to take your legs just over to the right a little bit, so your left hip is lifted. And then you're going to try to move your left sitting bone out to the left and away from you. Really trying to work, and again, that could be with your legs closer to you, sitting bone out to the left and away. Full big breath. And then bring your legs back into center. Your left foot comes to the ground, and now you're going to take your, your right foot comes to the ground. Now you're going to take your left knee toward your opposite shoulder. You can hold on to it with your hands here if you want to. That might be a little bit of stretch here through a little bit more of the glutes, maybe your IT band. Big deep breath. And then open it back up. And from here, you can just bring your legs as close to your body as you would like, just to experience that typical stretch that we do in this figure 4. Take some big breaths. And then set your right foot down, and then your left foot down. And then cross right ankle over your left knee. And again, you can have your left foot on the floor, or you can pick it up and draw your legs in toward you. Either one, whichever one works the best for you. And then you're rocking your legs over to the left a little bit so your right hip is lifted. And then you're trying to reach your right sitting bone out to the right side and forward toward the foot of your mat, away from you. Take a big deep breath. You can take in how this side feels compared to the other side, right? Because we're stretching both sides, even though most of the time sciatic nerve pain is only on one side. Full deep inhale, long full exhale. And then as you come back into center, you're setting your foot back on the ground, and then it's your right knee coming toward your left shoulder. And take a full deep breath, and again, recognize and notice for yourself how this feels. And then opening that knee up again. If you'd like, again, you can take your legs in close just to get that typical stretch that we usually get. Even though we direct the stretch in a particular way, because it has many different possible things that can stretch, taking the one that we know and love is always a nice thing to do for ourselves. It doesn't hurt, unless it hurts, and then stop. And now, put your left foot on the ground and your right foot on the ground. And walk your feet out wider than your mat. And you're going to slowly drop your knees from side to side, both knees to the left, then both knees to the right. And as you do so, you're letting your hip lift considerably. Get into that pocket muscle, okay? So you're going to take a moment on each side to let the hip lift. You're lengthening through the quad. Feet are flexed here. So as you keep your feet flexed and toned, that helps to support the knees. Now, if it's in your practice, the next time your knees come to the left side, if it's right for your body, then you're going to double check first that your right thigh is straight ahead from your hip, but then flexed feet, lift your left foot and set it over your right thigh for just a little added lift and stretch. So your hip will lift up a little bit more. Take a big breath. And if this bothers your knee on either leg, then come off of your thigh with your foot. And then releasing that foot if it's still on your thigh, take both knees over to the right side, and again, double check. Straight out from my hip with my thigh, flexed feet, and then maybe I set my right foot over my left thigh. For that little lift of your hip, length through your thigh, a little more stretch through the pocket muscle here. And then gently remove your foot if it's still there. Come all the way back up to center. And now one more stretch that I find really helpful. Keeping your right foot on the ground, you're going to lift your left leg toward you. Clasp behind your thigh and begin to push hamstrings into your hands, lengthening your heel upward. Take a big breath, and now think of your left hip and try to rotate your thigh bone so that your hip crease moves forward. Your toes will turn a little bit to the left when you do that. See if you can find that action. I like to take my thumb right into my hip crease to find that. Big breath. You can have your right foot here on the ground with your knee bent, or if it feels good to you, you can extend it. Either way. And now just slightly, you're taking your left leg across your body to the right side, still pushing onto that hip crease. What that does is it evens out your hips a little bit, gives your low back a chance to have a little bit of movement. So you can have a lumbar curve or a little lift in your low back. And then you're coming back into center, bend your knee, give it a squeeze. And then put left foot on the ground. Bring your right knee in, clasp behind the backside of your leg and begin to push. And again, as you push, think of rotating your whole leg in the hip socket so that your toes turn a little bit to the right side. And as you do that, you're welcome to use your thumb and your hip crease for that action. Take a big deep breath. And again, left leg can extend if you want, or your knee can stay bent, whichever feels the best. And then just slightly, you're taking your leg across your body to the left side. Not even enough for your hip to lift up, but instead, you're getting that length, like your hip is trying to reach into the ground and your heel is trying to reach diagonally across. And now back into center, bend your knee and give your knee a squeeze. And now both footprints to the ground. Go ahead and roll over to one side and push yourself up to your seat. hopefully those were some helpful stretches for you for your sciatic nerve. Have a good day. Namaste.